going inside the issues of our community. This is Local 12 Newsmakers.
Good morning and welcome to Local 12 Newsmakers. When America plunged into the Great Depression in the 1930s, the assumption was that private charities were capable of addressing the needs of the poor and the desperate. That view was very quickly swamped by the swelling tide of unemployment and underemployment. Like all modern industrial societies, the United States learned that the only organization strong enough to make a fundamental difference was the government. As we begin in 2009, the forces at play in our economy seem overwhelming. The danger in 2009 might be to conclude that individuals and private charities have no important role. The focus this morning is on two local grassroots efforts that remind us all that individual action and grassroots leadership is still meaningful. In both these stories, I have a conflict of interest that I want to be clear about at the beginning. Both are outgrowths, in part, of projects undertaken by Classes of Leadership Cincinnati, the 32-year-old program of the Cincinnati USA Regional Chamber. In August, I became the director of Leadership Cincinnati. Perhaps no area of modern American society creates greater angst than the healthcare system, particularly access to prescription medicine for the uninsured. The St. Vincent de Paul Charitable Pharmacy, which opened in September 2006, is an innovative effort to provide free, professional pharmaceutical care to people in need. The idea for the free pharmacy was advanced by a project team of 12 people in Leadership Cincinnati who developed a business plan that included organization, budget, incorporation of the drafting of a new state law to permit the charitable pharmacies to dispense pharmaceutical supplies. Keeping the pharmacy fully stocked has been a task from the beginning, especially as the economic situation has worsened and the demand has gone up. Last summer, Local 12 Medical Edge reporter Liz Bonus prepared this report on the work of the charitable pharmacy.
Every day, Mary Jane Cooper takes medications critical to helping her stay well.
Oh, yes. I got to take that blood pressure pill. That's the only thing I worry about is blood pressure. Then I have asthma, so I get inhalers and all that.
The good news is she's able to get those medications for free, thanks to the charitable pharmacy at St. Vincent de Paul in the West End. For more than a year, the pharmacy has been providing free medications to the and underinsured in the tri-state, but the supply has been limited by availability. Now, thanks to a new program called AZ and Me, the supply of many of these medications will not run out. It is sponsored by the pharmaceutical company AstraZeneca. The company makes a wide variety of prescription drugs, including those that treat mental health concerns, heart problems, and reflux disease. The important thing to note, however, is that patients who come in are not just given medication. They do go through a complete comprehensive screening program. That way providers can assess any other needs that might also make a difference in total health care. Just like Mary Jean Cooper did, you'll have the chance to also meet with a patient advocate.
Because the first thing we want to do is just assess your whole situation. You know, if you come in and you need medicine, and by the way, you're 70 and you're sleeping on the floor, well, you need a bed too. So we're going to assess your whole situation and see what resources might be available to you to meet your life needs.
To discuss the operation and challenges faced by the charitable pharmacy, I am joined this morning by Dr. Michael Jennings, an internist with the Christ Hospital Medical Associates, and Mike Puccini, a registered pharmacist with the Kroger Company. Both are members of the St. Vincent de Paul Charitable Pharmacy Board. Welcome to Newsmakers.
Thank you. Thanks for having us.
This is really great. This is a wonderful institution and organization. It's been here only very briefly. You know, Liz was talking about this relatively new agreement with one of the drug companies, but Mike, where traditionally have, and maybe still, do a lot of these drugs come from that are distributed free?
We really have multiple sources of medications at this point. One is through the programs that some of the big pharmaceutical companies allow us to access. Many of our samples come from private physician offices. That's how I first became involved with the effort. We get medications from some nursing homes through the Ohio Depository Drug Program. We're able to get medications that are not going to be utilized for patients any longer. And at the end of the year, at the end of the day, we have to purchase some of the medications. Last year we spent believe in the neighborhood of $30,000 or $40,000 to purchase medications that we couldn't access otherwise.
But still, that's amazing. I mean, $30,000 or $40,000 over the course of a year, that means a lot of doctors are just making their samples available.
We have currently about 18 to 20 offices that participate in the program. Typically, the Mike Espel, who's the pharmacy director, as well as some volunteer pharmacy students from UC, come to the office about every 3 or 4 months, pick up the samples. It's really quite easy. I'll appeal to my physician colleagues who may be watching and encourage them to participate as well.
So if more gave, the pharmacy would have more.
Yeah, absolutely.
Okay. Mike, on the being a member of the board, being with Kroger and overseeing a very different kind of pharmacy operation, and Kroger's is huge. Is there a way that Kroger's able to help besides your services? I mean, and what's the question about, drugs? How long are they good? I mean, there's all expiration dates. You have to be careful about all of that sort of thing, right?
Sure. The law that was passed to allow the charitable pharmacy to exist takes care of all of that. We're highly regulated and actually glad to participate in that. So everything that the pharmacy dispenses is safe. As far as Kroger goes, Kroger has participated with St. Vincent de Paul on a number of levels. We did have a $10,000 gift to them last year to get them started. We do some things with some unsaleable product to help them out, and just the general overall setup of the pharmacy was part of our task to.
Well, you mentioned this before, and I alluded to it in my introduction. This couldn't just open. There had to actually be a change in the law, because why? What was the problem?
The problem before is that once a medication is dispensed, it's dispensed and can never be reused. The repository program that was passed to allow the pharmacy to exist is so that samples could be used, and that you could go to institutions that had sealed medications, and once they were returned and credited, they can't be reused, but now they can be donated to the charitable pharmacy, and that's the big change in the law.
So that law makes this possible in other parts of Ohio as well.
That's correct.
It wasn't just for this institution. Mike, do you have any sense of how many people are accessing the program at this point?
Yeah, sure. I think on a daily basis, pharmacy is currently open 3 days a week. On a daily basis, we're certifying or recertifying about 10 patients.
Okay.
Unfortunately, there are another 5 to 10 patients behind them that we can't currently work with, can't deal with, because we don't have the resources. The growth of business, not surprisingly, has been exponential. There are a lot of folks out there who need this sort of service.
And Mike, who would be eligible? I mean, what type of person could qualify? I mean, there's so many people out there who, I'm sure worry about their drug thing, what the doctor has prescribed for them, and getting that. What's it take to be eligible?
Eligibility, there are several criteria, but really it just comes down to being in such a bad circumstance that you're in the gap. All of your expenses, and it's the same with St. Vincent de Paul, your expenses far outnumber what you could possibly take in. You might be working 2 jobs. All of a sudden you're taking care of a grandkid, and the washing machine breaks down, and guess what? The doctor just told you you're a diabetic, and now you need $150 worth of medicine a month. And there's no way you can make those ends meet. So to get them at least started until you can get them into further programs, that's the gap that the charitable pharmacy fills, to get them going in medical care.
Dan, if I could add to that, I think people would be amazed to see who qualifies for the program. These aren't just people on the street who are homeless. These are people who are in between jobs. Some of our clients are Medicare patients who have Medicare Part D, but fall into the donut hole towards the end of the year. I mean, the variety of folks who qualify for the program is quite extensive, and so we're talking about a potential number of people that's almost unable to be estimated.
And Liz Carter, who's the executive director of the overall St. Vincent de Paul effort, was talking about, and one of you mentioned that you have to certify or you bring in potential clients. What sort of information are you looking for? And is it is one of the questions that's being asked, one of the types of questions that's being asked is there any program that this pharmacy can tap and get reimbursed for some of the cost that's involved here?
Yeah, well, actually, it's a little bit different than that. What we're looking for is whether or not the individual is eligible for another program that's already in existence.
Oh, okay.
Are they eligible for Medicaid? Are they eligible under the Hamilton County tax levy to receive their medications elsewhere? So we're really not looking to be reimbursed, but we are looking on an individual basis to see if any of the clients who come to us might qualify for another program where they can get their medication.
Which then frees up what you have for somebody else.
For the next person down the line, right?
Yeah.
Getting them into the right program is one of the big things that we try and do after making sure that we've taken care of their medical care. Okay. Getting them to where they can have a constant supply.
You know, this one of you mentioned before as an example, diabetes. And it just seems like diabetes, I hear more and more people, a number of people who worked for me at an earlier job at the museum center were diabetic. Those of us who are not maybe don't understand how much is involved on a daily basis for care and how costly that is. And that seems to be soaring right now, the number of people who are diabetic.
An epidemic is not an overstatement of the case. And I think, again, when you look at the total cost of care for diabetics, it's not just the insulin, it's not just the oral medications for their diabetes, but they require any of a number of other medications to treat other conditions that are more frequent, their heart disease, hypertension, kidney disease, and even the cost of testing their blood sugar. You know, believe it or not, a test strip to test your blood sugar, if you buy it at a retail pharmacy, it's about 50 cents a strip. So if we ask people to test,
is used once?
One time.
And how often does a diabetic need to test?
Well, once or twice a day, oftentimes. So you're talking about $1 a day potentially. And again, most of these folks don't have the wherewithal
just adds
to
up.
test their blood sugar.
It just adds up.
So you were saying that the pharmacy itself is open 3 days a week at this point?
That's correct.
And this is it is physically, and we're going to give some information about how to access it, but it's physically on Bank Street in the West End. Am I right?
That's correct. You can see it from I-75, right?
And how do most people come to you initially? How does a person, are these people who just sort of seek you out? Are doctors making references? How do people come to the free pharmacy?
Over the past 18 months that the pharmacy's been open, the social network has been substantial and had substantial buzz that it's available. So the word is out, and that's part of our demand issues that we're having. We'd like to be open more days a week. But we have to garner the samples, we have to tap the repository program, and we just need donations too to help us with what we have to buy and service.
So having more doctors become involved would be one help, but also just having cash donations so you can buy the specific medicines that
we
you
can't
need.
get any other way.
Yeah, because I'm sure there are some gaps that people just don't. It's not there when the patient comes in.
Right, and the other neck in the funnel right now is just manpower. We really need to hire a pharmacy technician to help the registered pharmacist to meet the increased demand, and the only way we can do that is by financial support.
And what about the registered pharmacist? Is that person an employee? Is that person a volunteer? How do you run that? Because you do have to have a registered pharmacist overseeing all of this,
Correct, our pharmacy manager, and he's part of the St. Vincent de Paul organization, but we also have other pharmacists that come in and some that volunteer their time.
Okay,
and
they do.
We'd like to see more of that too from the pharmacy community giving back a little bit. It would be really a special deal.
I gave a presentation probably about a year ago to the retired pharmacist of Greater Cincinnati.
The Veterans Apothecary.
That's right, the Veteran Apothecary.
I'm almost there, Dan.
And I had no idea they existed. This was a fun group, let me tell you. They had 1 million stories. This was a lively group, but
I'll have to take his word for that.
So this is a sort of group that you could tap. But so tapping doctors for more donations, tapping pharmacists, but also all of us can get involved in this. And for your involvement, what's it meant for you?
Oh, it's terrific. You know, Mike and I and most of us on the board, of course, have been blessed with good health and plenty of resources, and it's a good feeling to know that you're helping those who really need a hand up.
And Mike, are you feeling, I think it's obvious and we've hinted at this, but I want to make sure it's clear, the pharmacy is feeling more of a demand right now because of the downturn in the economy?
Absolutely so, and that's true for all of our needs, but the pharmacy, it's the only one. You could run across, if you do a little Google search, about other nonprofit pharmacies, but this is the stopgap. This is the free pharmacy where people that are absolutely desperate, need to take care of their health, it's where they go.
Okay. Thank you very much. People know how to find this. If you would like to contact the Charitable Pharmacy, you can call 513-562-8841 or check the website at www.svdp, that's St. Vincent de Paul, svdpcincinnati.org. A parallel similar program exists in Northern Kentucky. Check out the Faith Community Pharmacy at www.faithcommunitypharmacy.com or call 859-426-7837. Thank you very much for being here this morning, and thank you for the work that you're doing. In the midst of an unremitting set of job losses, there are some jobs still available, and a training program designed to increase the likelihood of long-term success if a person lands one of those jobs. Stay tuned. Welcome back. Call centers have become a staple of modern life. Customer service representatives staff banks of phones, handling all sorts of technical and general questions for customers. Although many businesses have moved their call center operations offshore to India or Ireland, thousands of jobs exist locally. A Leadership Cincinnati project team developed a plan in cooperation with the Urban League of Cincinnati to develop ACE, Accelerated Call Center Education. The goal is to provide training in the necessary computer skills and customer service skills that will allow a graduate not only to get a job, but to hold the position in a field that drives many out in a short period of time. To discuss the Accelerated Call Center program, I am joined this morning by Joseph Flack of the Greater Cincinnati Urban League and Rahman Shabazz, who is the Business Development Director of the Urban League. Joe is the Director of the ACE program. Welcome to Newsmakers.
Thank you.
And Happy New Year.
Same to you. Same to you.
Now, let's begin with this program very specifically. What's the goal here? When we say there's a training program, how long is it, and what are you trying to train people in that particular situation?
Well, the ACE program is a 4-week training program. It's 4 days a week, Monday through Thursday. We train our participants how to work in the different call centers, the various call centers in the greater Cincinnati area. We train them on customer service skills, listening skills, communication skills, problem solving skills, and we also have a simulated call center at the Urban League where before this program is over, they actually take real calls.
Okay. Now, Rocky, if in this particular situation, if a person goes out there and gets hired into one of these call centers and doesn't have training, what is it that they face, and why do so many of them not end up really staying in those kinds of jobs?
Well, customer service is really a job in which people have to go out and interact with customers. Develop the kind of customer service skills that will allow the customer to understand what your product is all about, how to generally listen to the customer, and how to respond to the customer's needs. We understand that, smiling is one of the key factors of why you're on the phone and work with the customer. So that's related to that customer over that phone call. And so knowing what your product is, how you can assist that customer, and effectively listening to their issues and needs, and responding back to helping them to retain that customer so that they come back. they come back, they want your product, they enjoy working with you over the phone. And so those are some of the things we're teaching at the Urban League.
And I want to be clear, in this job market where jobs are really tight, my understanding is that there actually are jobs in this community in call centers. Is that right, Joe?
Right. There are over 60 call centers in the greater Cincinnati area.
Wow.
On a daily basis, there's probably 5,000 people employed in call centers. Now, understand what happens, there's a lot of turnover also. And what these companies are looking for are, they're looking for people to work there who are committed, who are motivated, and who are trained. What we do at the Urban League, we prepare them for that position. When they spend 16 days with us, at the end of that 16 days, they know they want to work in a call center. They actually research the companies they want to work for, so not only are they qualified and trained, they're also motivated.
And how do you then help, meaning the Urban League, do you then help get them placement in these various call centers?
Yes, that's where Rocky comes in.
Yes, once the students, men and women, finish the ACE call center training, then we sit down with them, we bring in various employers throughout Cincinnati to come in and mock interview them so that they know how to go out and be able to sell themselves to an employer.
Wow.
Once that's completed, we'll sit down with them, myself more importantly, to find out what it is that they're interested in doing. And we found out that when we place an individual in the kind of job that they're interested in doing, we found out that the retention rate goes up. And so it allows people to stay on that job a lot longer. What we found out is people coming through the ACE program has actually, it's been in like an 89% retention rate for employers. And so a lot of employers are very excited about working with the Urban League.
From the employer's point of view, turnover is a terrible thing.
Absolutely.
They have to retrain, and that's costly to them.
That's right.
And inefficiency of a new employee and all of that kind of stuff.
Right.
So who's eligible for this?
Well, you have to be 18 years old or older. We prefer people who do not have a blemish on their record, especially theft. We can work with some of the other problems they may have, but 18 years and older. We've had students as old as 60 years old.
Mm-hmm. And it's a 4-week program. How often do people will be watching this show, it's early January. How often do these programs start so that somebody could get in if they're interested in this?
We run about 10 of these sessions a year.
Okay.
This year, the first one starts January the 5th, Monday, January 5th. Another one starts in February, and another one will start in March.
Okay.
Then there's some few weeks in there around holidays and things where we may not have the program running, but it runs all year long. We also have an evening class. There may be some people who already have jobs, but they want to increase their skills. They're looking for a better job. We have an evening class that runs Tuesdays and Thursdays from 6 to 9 p.m. and every other Saturday from 9 till 1.
And what kind of salary, what level are we talking about in terms of entry-level salary for a new call center employee? And then also, if somebody really is good at this and stays with it, sort of what can they get to?
Right now, we found out through working with various call centers in the with Citigroup and Macy's and Children's Hospital and a lot of the companies that have opportunities in call center, they're paying anywhere from $9 to $16 an hour in a call center.
Wow.
So there's a lot of opportunity to just come in and start maybe at a decent level and be able to grow with the company. So there's a lot of opportunities.
So are these jobs that are full-time jobs that also have benefits?
Yes, absolutely.
Oh, yes.
Benefits, 401k, most of them are
Healthcare?
starting healthcare.
Healthcare.
They're starting healthcare day one. But more importantly, what we found out, a lot of the call centers actually have 100% tuition reimbursement. So if individuals interested in going back to school and developing a higher skill, they can also, go into these companies.
So it can be a foot in the door.
Absolutely.
And what about the cost of this program? Does the individual student pay for this?
No, they don't pay a thing. It's free. It's free. As a matter of fact, there are some companies here in Cincinnati who helped the initial start of this program back in 2005. Companies like Cincinnati Bell, Cintas, Western and Southern, United Way. Greater Cincinnati United Way is one of our big funders. As a matter of fact, they purchased the computers that we use in our simulated lab.
And how many people have been through this and successfully found jobs?
Well, currently, right now, I think we've probably put at least about 180 people through the ACE call center training.
Wow.
And I would say at least about 136 people are currently working in that field. And so it's really been really successful. People coming in and getting the skill to be able to go out and work in that customer service industry. Those jobs are always out there.
It sounds great. I mean, it sounds like a niche in this market, which is a very tough market that people will want to know about. And if you want to learn more about the ACE program, you can call Rocky Shabazz at 513-487-6525 or check the Urban League website at GCUL, Greater Cincinnati Urban League.org, and there's a lot of information there. Those who watched last week know that I mentioned that Odell Owens, the Hamilton County coroner, was to be my guest this week. Unfortunately, Dr. Owens fell on the ice just before Christmas, badly injured his leg, and was unable to be here this morning. I invited Dr. Owens because of his expansive, challenging, and hopeful vision for the community. A great way and a great message to begin the new year. I wish Odell a quick and complete recovery. He also knows that he always has an invitation to be on this show, and he will join us in the future. Thank you for making Newsmakers a part of your Sunday morning. Have a good week.